Hello, and welcome to the American Massage, Chiropractic, and Acupuncture Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in San Diego April 20th through 22nd, 2012, and who are brought to you by the One Concept Group. I'd like to take this opportunity to thank the 2012 American Massage, Chiropractic, and Acupuncture Conference sponsors, Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, Massage Envy Careers, for making this year's event possible. Our very special guest today is James Weslowski. James and I will be talking about his 2 full-day classes, orthopedic massage for complicated shoulder conditions and pelvic stabilization, and orthopedic massage for complicated cervical conditions and elite sports therapy. But first, let me tell you a little about James. James Weslowski is an author and international lecturer who teaches approximately 40 seminars per year around the globe. He's served as AMTA Sports Massage Chair and the FSMTA Professional Relations Chair. He's developed 7 orthopedic massage and sports injury DVDs and authored manuals on advanced orthopedic massage and client self-care. James is also a certified personal trainer with the National Academy of Sports Medicine. James presents at state, national, and international massage, chiropractic, and osteopathic conventions, including keynote addresses at the FSMTA, World of Wellness, New England Regional Conference, the World Massage Festival, and Australian National Massage Conventions. His audience includes massage and physical therapists as well as athletic trainers, chiropractors, osteopaths, nurses, and physicians. James received the 1999 FSMTA International Achievement Award and was inducted into the 2008 Massage Therapy Hall of Fame. James, welcome to the American Massage, Chiropractic, and Acupuncture Conference pre-conference broadcast series. As always, I'm excited to talk to you about your classes, in particular, the classes at the American Massage, Chiropractic, and Acupuncture Conference. This time we're going to be talking about orthopedic massage for complicated shoulder conditions and pelvic stabilization, and orthopedic massage for complicated cervical conditions and elite sports therapy.
Thanks, Felicia. I'm excited to be here. As you know, I speak in all the major conferences throughout the world practically, and this is certainly becoming one of the premier conferences I've ever had a chance to experience, both from the perspective of the people sponsoring as well as the participants, some pretty heavy hitters coming to the lineup. So I'm honored to be a part of this group.
Well, we're excited to have a heavy hitter like you at the conference, James.
Thank you.
Now, you were talking about this being one of the premier events. I'm curious, why do you recommend that massage, chiropractic, and acupuncture practitioners and students attend events like this one?
Well, Felicia, I think one thing I do, like I'm heading off to Australia in about a month, and when I teach at the Olympic Training Center, I teach what's called integrated manual therapy, as do most. If you look at people like Eric Dalton and Whitney Lowe and David Kent, integrated manual therapy to me is how do we work together with the chiropractor, with the acupuncturist, with the nutritionist, with the energy work, and all of the different incredible parts of the modalities of this industry. So I think the beauty of this conference is that we're actually being able to cross those what used to be barriers. In Europe, I find that there's less barriers between the different manual therapists in the United States. I'm hoping that we carry that back to conferences like this. So I think it's the missing link in the manual therapy industry.
Well, that cooperation and collaboration is definitely something that's important, and I think that is really part of the focus of this particular conference, having expanded from just massage into massage, chiropractic, and acupuncture, and who knows, maybe later other disciplines. So I think that bringing the resources and the knowledge that we have from different modalities, different places in the world is really vital. And I think this place is going to do all that, or this event is going to do all that, but it's going to be a lot of fun too.
It's going to be great.
So I know that we've got a lot to talk about with you have these 2 full-day classes at the conference. I want to give people just an overview, first of all, and find out, what exactly is orthopedic massage and how it compares to modalities like medical massage, clinical massage, or sports massage.
Felicia, orthopedic massage is really, I would call it an integration of multiple modalities and multiple different manual therapy techniques. It starts with really detailed ongoing assessment, study of pathology, clinical reasoning. Much like if you looked at what a physical therapist or orthopedic surgeon would do, we are really obligated to do a lot of assessment, palpation, special tests to determine treatment plans. As far as referencing it to medical massage, clinical massage, or sports massage, I think these are just a play on choice of buzzwords. Whether I'm working with an athlete in the field of sports massage, or I'm working in a hospital in a clinical model, or I'm simply treating a patient with a medical condition, I need to be able to differentiate, to get a good medical intake. I need to be able to do evaluations. I need to be able to work, our therapists need to be able to work with the doctors, the physical therapists, the athletic trainers, the acupuncturists. And we have to look at the spiritual, emotional, physical needs of the patient. So I think that I don't call it medical massage just because I want to honor my colleagues' work, which would, visceral, lymphatic, the energetic work. There's so many things, so many different modalities that deserve to be in the umbrella of medical massage that orthopedic massage, since I'm pretty much looking at structure, posture, function, movement, pain-free living, and treating the symptoms of clinical conditions, we've called it medical or orthopedic massage here, but the new textbook that I've written, which we'll talk about later, is called clinical massage. So it's sort of a twist of all of these things blended together.
Well, that helps a lot. So it's really kind of a broader term than maybe we think, but you're just giving room for some of those other modalities to fall under the medical massage. And I think that's a really inclusive way to think. I really appreciate that. Now, this conference has been opened up to a variety of practitioners. Tell me, what type of manual therapists actually benefit by doing this work?
Felicia, I think what I've done in spending most of my life writing books, doing videos, and traveling the world, what I've done is I've had the opportunity to teach at chiropractic conventions, physical therapy conventions, athletic training conventions. I do get a lot of acupuncturists that get certified in my work. I get a lot of chiropractors certified in this work. And so I think as far as anyone that does manual therapy, anybody that touches the body, that tries to facilitate balance and pain-free living, anybody that tries to eliminate musculoskeletal conditions throughout the body, whether they're looking at, levels of the ilium, or they're looking at the cranial base, or they're looking at soft tissues that pull, bones onto nerves and blood vessels. I believe that because our role is to restore normal muscle resting lengths throughout the body, blending modalities, teaching clients exercises to sustain structure, posture, function, and balance, that every manual therapist that deals with patients with pain, injuries, trying to enhance performance potential would benefit from this work.
So then can orthopedic massage be pretty easily implemented into, let's say, a spa treatment or perhaps a chiropractic session?
The other beauty of the work is, I consult with a number of people that have spas, and what they're finding is, I'm going to Canyon Ranch next month, and in Canyon Ranch, it's such a wellness-based environment of a medical facility, and I'm finding even the smaller spas. You look at even Massage Envy, or not the smaller spas, but the spas that more specialize in relaxation, are also seeing every patient that walks into that spa has some form of musculoskeletal pain, whether it's tendinosis of the elbow, a little bit of low back pain from tight psoas. The beauty of the work is we break it down by body parts. So if you have a lower extremity condition, the therapist in the spa setting could say, hey, let me treat that minor muscle tendon pain of your Achilles, and then time permitting, I'll do a relaxation massage. So the beauty of this is if you're a male therapist, you're going to get a much higher request for treatments, because every single person that walks into that spa is going to have some form of musculoskeletal pain condition that could be addressed in a minor condition in a spa setting. So the beauty of it is it transfers from the spa setting to the chiropractic setting, complements chiropractic, and also complements whatever you would do to that patient that comes in for relaxation.
Fantastic. Now, I know one of the things that I hear a lot about is people complaining about the economy and they aren't seeing patients as much as they used to. How will therapists make their practices recession-proof with the addition of this kind of training?
You know, Eric Dalton, my good friend and colleague, wrote the foreword to my new textbook on clinical massage, and he really addressed the recession-proof of your practice. He said, forever people are going to have musculoskeletal pain conditions. And so as we align with all the other manual therapists and we address those minor musculoskeletal pain or major conditions of the body, it's recession-proof, because even at a time when I can't afford relaxation, I can't afford not to be in a pain-free body. So we're finding that the practices, they can charge more, they're going to see more patients. There's no doubt about it. It will recession-proof your practice if you're able to evaluate, treat, and then play a critical role about client self-care, what they're doing to take care of themselves between therapeutic sessions. You will change their lives, and certainly it'll change your income.
So by doing work that's easier on your body and getting your patients and clients better results, not only can you physically see more people, but you can also, you'll have more people because they're getting the results they want, and that's obviously going to bring more people to you.
Yes, and those kind of results speak for themselves. They basically, if you get one person out of pain that's had pain for 5 or 10 years, I guarantee you they're going to tell 5 other people who will tell 5 other people the work that you do. So really, a lot of people that get certified in orthopedic massage really they don't advertise in the yellow pages. They don't have a big budget for advertising, because word of mouth marketing certainly says if you want to get out of pain and perform at the optimal level as an athlete, this is the person you should see.
Well, you know me as a marketing professional, that's what I like to hear. So I'm glad that this is going to help people to market themselves without spending a lot of money. So now, James, you are talking about 4 different topics in your 2 full-day classes, orthopedic massage for complicated cervical conditions, then also for pelvic stabilization and complicated shoulder conditions, and then you also mentioned elite sports therapy. Can you tell me a little bit about each of these?
Yeah, the reason I chose these particular topics is one of the hot topics in our industry is a thing called multiple crush phenomena. I had a patient in Boston who had carpal tunnel surgery of his wrist, and that didn't work, so they cut into his elbow, and that didn't work, so he came to a seminar, and we did some cervical and shoulder work, and all of the numbness, tingling, paresthesia went away. So what we do first in the cervical conditions is we look at the role of superficial front line as taught by Tom Myers. We look at how that shortening of the rectus abdominis, the sternum, the SCMs that pull that head forward. And then we look at how the atlantoaxial joint can be reset. We look at things like opening and closing facet joints, looking at shearing forces in the neck. And the beauty of what I'm saying now is it fits perfectly into the chiropractic model. So we reset the atlantoaxial joint. We look at shearing forces of the neck. We look at facet joints that are not open and closing. And as we soften the tissues and facilitate myoscleral alignment, we are going to drastically complement what the chiropractor would do. When we get into the shoulder work, that's my passion. That's the one that I think that I have really been blessed to facilitate healing with is frozen shoulders. We didn't used to think, I used to say, well, based on my vision or my intuition, this is what's happening inside the joint capsule. But we will clearly define, how to treat a rotator cuff, how to treat thoracic outlet, how to differentiate between interfascial adhesions of the joint capsule and outer capsular adhesions, even how to look at advanced frozen shoulders where they've got impingement of the shoulder and, chromium is pressing on that tendon. You've got tendinosis. You've got interfascial adhesions and capsular involvement. And even though what I'm saying might sound complicated, Felicia, with the multimedia images that I use, Pearson Publishing did an amazing job transforming muscles, bones, ligaments, fascia into the human body in our new textbook. And so what we do is on one large screen, you're going to see inside of the human body my hands directly on those tissues, exactly the way they need to be treated and why they're causing a certain clinical symptom. You will actually see a computerized image of the inner fascia of the shoulder and the outer capsular fibrosis of the shoulder, and clinical studies and clinical research that supports how we can release frozen shoulders, which tends to defy modern medicine. We'll also look at pelvic stability. I think that pelvic stave, to me, if we don't level off those iliums and treat leg length discrepancies and get rid of those disc pathologies and get rid of sacral torsioning. And again, sacral torsion would be something that would be exciting, the way we approach it, exciting to the chiropractor, to the acupuncturist, to the other manual therapist, because if we can look at the relationship of the iliums to the sacrum and the torsioning and the muscle imbalance of the lower back and the way that the discs are being compromised by, say, a leg length discrepancy, it'll drastically change everything you do. We call it ascending syndromes. When the pelvis is unlevel, you're going to have upper thoracic scoliosis. You're going to have the adlenoaxial joint thrusting forward. You're not going to be able to treat the upper body because you haven't leveled out the legs and the pelvis. So that'll be a great course. And then our fourth one is becoming one of the hottest courses throughout the world, actually. I'm teaching it this year in Canada, Australia, London, Ireland, Scotland, New Zealand. It's called Elite Sports Therapy. You mentioned earlier in my bio that I was the National AMTA Sports Chair. And back then, we thought pre-event was good, post-event was good, working with the athletes in the event environment. But elite sports therapy goes way beyond that. It takes a look at biomechanics of different sports. It looks at functional movements that would say someone does a squat and their knees come out and their foot rotates and their back arches. If we put them in a circuit training, as a certified personal trainer, if I was to work you out, I would make sure I balanced out all the muscles of the body first. Because if your psoas is tight and your back is arching and your SCM is tight and your head is thrusting forward and your knees are coming together because the adductors are tight or your lateral gastroc is rotating your knee, and I put you on a bicycle, you're going to blow out your knee. So we're going to look at common sports injuries, working with that strength and conditioning coach, working with that athletic trainer, working with that chiropractor. We're going to talk about elite sports therapy is way beyond pre and post event sports massage. It's what the athletes are expecting at the high level field of sports massage.
So I'm curious about that. I've recently, I wouldn't say I'm an elite athlete, but I've been competing in some triathlons recently. And so I'm hearing this and I'm saying, well, now, how do you determine the imbalance of the muscles and what to strengthen in order to get the person where they're not going to have an injury?
Felicia, first we look at Philip Greenman's upper and lower cross syndrome. By law of nature and posture, there are certain muscles that will always be short and tight and opposing muscles that are weak and inhibited. But as a triathlete, which is one of my passions, say you're going into the swim and you stretched out your pec minor before you swam and as you came out of the water. That would give you less compression on the nerves of your shoulder. And say that you're coming off the bike where you've been in flexion for, God knows, in an Ironman, 112 miles.
That's
and
not
I put
me.
you on the but just say for the elite level triathlete, the world class, or the amateur triathlete. But when you get off the bike, if I was waiting at the transition before you did the run and I got you on an exercise ball and I simply stretched your superficial front line, so when you go into that run, you're not flexed at your hips, your head isn't forward, your stride is better, you're performing at an optimal level. So inter-competition, or Felicia, if I see when you're running and your knees rotating abnormally, well, if you come out of the run from the pool to the bike and your knee is rotating externally and you strap yourself into the bike and I don't lengthen your biceps femoris, which would take me 30 seconds in the transition, then you're going to injure your meniscus, your MCL, your LCL. So as we look at movements, or say that your hip flexors get tight, and I don't have you stretch your psoas for 15 seconds before you go into the run. Well, when you start running, you're going to get synergistic dominance. Instead of your glutes firing, your erector spinae and your hamstrings will be firing, and your back will hurt, if not be injured, when you finish the run. So as I look at these athletes performing, I tell you, I was in the Ironman and watched them perform. Their bodies are really messed up. Their foots are not striking normally. Their knees have excessive rotation. They've lost stride length because of hip capsule and psoas tension. I tell you, you can make a world difference in how you can perform, and more importantly, how you feel after your workouts. You're not sore following those workouts.
It sounds like it could be, a whole instant clientele right there working.
It really is. It really is. I consult with a lot of professional sports teams throughout the country, and they'll call me up and say, "We've got this," and I'll say, "Well, do these 3 things, and that'll go away." I mean, it's a simple 3-minute consulting. The therapist applies the techniques. I had a chiropractor call me from the Midwest yesterday, this gentleman injured the knee. We did all the assessments of the knee. We narrowed it down. We corrected the rotation, and the person was out of knee pain in just minutes. So as you learn to look at postural and functional movements, you can say, before I take you to working out the next day, we need to correct these imbalances, and then I give you some rollers and some bands to soften tight muscles and strengthen and tonify weak muscles, and you perform better, you feel better. It's way beyond sports massage. I'd like to say elite sports therapy is what you're doing the next level of sports massage, the elite sports therapist.
So I just need to take you with me to all of the events I'm in. Is that what you're telling me?
There you go.
Or get someone who's taking your class to come with me.
Yeah, that's why I teach like 15 to 20 conventions a year, is to try to just spread this off to as many therapists as I can.
Great. Now, I want to go back to something you were talking about. I was having a little bit of I don't know, the wheels weren't quite turning when you were saying this. You were talking about in your book, or maybe it was your presentation, about how you can actually see your hands inside of a shoulder working on that. Is that from your book, or is that in the...
Yes, I spent 7 years with writing a textbook that was just released by Pearson Education, Pearson Publishing. An incredible graphic artist, Marcelo, came in and they shot like 2,000 photographs. And in every photograph, they laid inside of the human body real muscles. So if I'm on your psoas, you're seeing my hand on your psoas. If I'm actually massaging the inner fascia of your shoulder capsule, you're seeing inside the shoulder capsule. If I'm working on scar tissue and it's multidirectional on a tendon strain, you're seeing the multidirectional scar as I work on it directly in. I said one day to my colleagues, I said, what if I could take a microscope inside of the human body, and you could literally look at every cell or every piece of tissue, ligament, bone, tendon, whatever I'm touching with my hands. And they kind of laughed at me and said, what are you going to do, hire Spielberg? Well, I have to say that Pearson Education came as close to what I think Spielberg could do in taking you inside of the human body. And the beauty of the new book, The Clinical Massage Therapy, A Structural Approach to Pain Management, is that we have made PowerPoint slides. So as I do my presentation on one large screen, if I'm working your hip capsule or so, as you're seeing inside of the human body the pathology of what the technique is accomplishing, and then on the other screen you're seeing my hands do the technique. So as therapists are typically kinesthetic, and they're typically visual learners. So as they look inside of the human body and practice the technique and see literally every tissue response, literally what I'm touching, it transforms the learning experience.
And so has that changed the way you are teaching, or is that...
It's not only changed the way I'm teaching, Felicia, is that instead of using overheads, which I used to use, if you go back to the early days, like when I studied in the 90s, we'd use things like the black and white sketches of Segan Adams and so on. Then we would move into things like the primal interactive DVDs, where you can actually see functional movement and antagonistic relationships of muscles. I think this takes it to the next level. As an educator, I was teaching the Arizona conference just last weekend. On one huge screen in the ballroom, they were literally in awe as they saw that inner fascia, that joint capsule. They saw the scar tissue fibers change directions. I think it's transformed the way I work. I think I can better get to the new therapists, have aha moments, and the chiropractors, the doctors, the people that have their PhDs go, wow, this person really knows his pathology, his anatomy. They're taking us inside of the human body for a look that we've never seen before in modern dissections. So the dissections were transformed into computerized images, which were then laid into throughout the human body, throughout the body. So everything we do in this conference, you will be looking at that torn ligament. You'll be looking at that scar tissue and that tendon. You'll be looking at that inner fascia. You'll be seeing exactly where my hands need to be laid on the psoas or the iliacus or the scalenes. It's really transformed. And this has only been since the book came out about 6 months ago, that this has really been a transformational way to educate manual therapists.
That sounds awesome. It sounds really totally incredible. I'm trying to picture it in my mind. I'm going to have to sneak into your class for a minute or two. I know I can't attend the full time, but I can come in and I'll bring you some water or something.
There you go.
That just sounds fantastic. The idea of being able to see the tissue, that, what you're working on and what the potential effect of it is. I think
the closest any book I've seen that's come to this type of graphic inlays and artwork is the Basic Clinical Massage by Clay and Pounds. And that was the prototype of our vision, which we spent 6 years then enhancing. So I think the closest I've seen to it is the Basic Clinical Massage by Clay and Pounds, and so that was how we were inspired to say therapists need to look inside of the body. So basically every time you touch the tissue, you have intention to create a specific change, and that's the beauty of matching the modality to the pathology of the underlying condition and seeing it as you do the work.
You had talked about multiple crush phenomenon earlier, and I know you'd written an article about it not too long ago for Massage Today. Will you be able to show some of that with the same type of thing, and how are you going to deal with that at the conference?
Yeah, the beauty of that is as you go from the cervical work to the shoulder work, you will see as nerves get compressed, say you have the facet joint dysfunction in the neck and you have a C1, C2 shearing of the neck and your atlantal axial slides forward, which are things we're going to learn in the cervical section. That'll compress nerves once or twice in the neck before it ever gets to the shoulder. And then when we go to the shoulder, we're going to look at the role of the scalenes in the first rib and the pec minor on the nerve compression of the shoulder. So now we have a third crush on nerve roots between the brain and the hand and arm. And then we'll transition into the elbow where we look at the bicipital aponeurosis and the pronator teres and how there's a third, fourth, fifth crush of a nerve root. So by the time it gets to the median nerve in the wrist and the carpal tunnel, people don't have a chance. They're having unnecessary surgical procedures of the wrist. In fact, people can go on to Massage Today. They can go onto their website. The article on their website actually shows the artwork from our textbook. So Massage Today's website has the article on multiple crush phenomena, which is the focus of these different lectures that I'm doing, and again, people will be very enlightened to see how many people are having unnecessary carpal tunnel surgical procedures done to their wrist when it's a neck, shoulder, and elbow problem first and foremost. If not, that's the only problem. So I think we're looking at this backwards. We shouldn't be looking at the wrist for carpal tunnel. We should be looking at the neck first, shoulder second, elbow, and then forearm, wrist, and hand. And we would be performing what the medical industry would call as miracles, resolving nerve compression pain. So again, this will really enhance us working with the osteopath, the chiropractor, and the acupuncturist as we integrate what we're doing with these. Some of the work is Paul St. John's work. Some of it's Eric Dalton's. I love to honor my colleagues who have taught me this work. I'm just kind of refining it and making it user-friendly for the massage therapist to be able to instantly implement it into the session after they leave the seminar.
Wonderful. Well, I can tell you that looking at that article is on my to-do list now for today.
It's one of the best I've written. It's really one of the best articles I think I've put out there.
Well, good. I can't wait to read it. Now, we've talked about the multimedia part of your presentation, but I'm curious how much of the training is going to be hands-on for the people that are in the classes?
Felicia, I'm a huge advocate. This is a manual therapy industry. Personally, you will never see me certifying people without hands-on training. So the hands-on for me has to be about 70%. Every 4-hour workshop has to have 3 hours of hands-on for me, because you can talk to me. I'm not an auditory learner, so you can talk to me forever. But once you put it in my hands and then you give me feedback, and then I feel your hands, and once I see inside of the human body as I'm applying these concepts. And the other thing I bring in the multimedia is I bring all kinds of skeletons. So we can see the atlantal axial joint, and then that's broadcast up onto the big screen so they can see inside of the skeletal system. I show the relationship of bones and nerves by bringing models. So in addition to the multimedia images, we've got teaching skeletal models of the neck, shoulder, arm, wrist, hand that'll show you literally what we're talking about as we go from the person to the image on the screen back to the skeletal model. We touch all senses. My daughter taught me, she's dyslexic, and she said, you really need to simplify and really need to touch the visual, auditory, kinesthetic learning styles because everybody learns different. So we really tap into that.
Well, I think you're absolutely right. And the learning styles keep changing. We even get other learning styles beyond what the traditional were when you start getting into the younger folks with, that are so used to having a digital component to their world, whether, it's in their hand with a phone or what have you. So I think that really is going to be helpful to keep the attention of all the students.
Exactly.
Now, you were talking about certification a little bit, and I know that I've heard here and there that you and Whitney Lowe were talking about doing some kind of a master certification in orthopedic massage by combining both of your certification programs. Can you tell me a little bit about that?
I'm really excited about this, Felicia. I think this is going to be one of the most premier certifications, literally, and I almost want to say on the planet, because like I said, just in the next few months I'll be in Europe and I'll be in Australia, New Zealand. Whitney Lowe goes into such great detail on pathology, clinical reasoning, functional assessment, orthopedic assessment. I don't think that it's funny because I got a call from a chiropractor yesterday. He wanted to know some of the assessments that are taught by Whitney Lowe, that are taught by him and myself, so that he could further assess one of his patients. And I believe that because Whitney's information is so incredibly detailed in describing the difference, say, between adhesive capsulitis and frozen shoulder, literally telling the manual therapist what the pathology is, we both focus on treating the cause instead of the symptom. We treat both, but we treat the cause, structural, postural cause first. And the beauty of our joint certification is you can go online and get his pathologies, assessments, clinical reasoning, and then you would go through my weekend courses and my 5-day intensive courses, and you have an opportunity to get certified with just Whitney Lowe in orthopedic massage or just with myself with orthopedic massage. But now as we integrate those two certifications and we get a mastery certification, I can guarantee you that you will be so highly respected by the orthopedic doctors, the physical therapists, the athletic trainers. A lot of athletic trainers that have gone through the certifications are now working with professional sports teams. They have an edge over their colleagues because now they have the orthopedic assessment. And again, we're using this as an orthopedic certification, orthopedic assessment, but as we talked earlier, whether you call it clinical massage, medical massage, orthopedic massage, there will be, I'm just overly excited that we are raising the bar by instead of competing with each other, we're aligning our fields of expertise, and I really believe this will get us the respect we deserve in this great profession.
Well, I think that inclusiveness and working together and really seeing room for all at the table is a fantastic way to think and be. I know that that's the philosophy of the people that have organized this conference, Scott, Angie, Monica, Robin, and Lorna, and it's, that's why the presenters that are there, such as yourself, are included. That I think they share in that vision and really are committed towards working together to creating better resources, better training, and really, if you look at it, just a better world through working collaboratively instead of against each other.
Exactly.
Now, James, I know there are a lot of people that are going to want to take your course in San Diego but won't be able to get there, but perhaps they can connect with you somewhere else since you're around the world so much. How can people find out about your other courses, purchase your book, and get information on you and the other things that you offer?
Hey, Felicia, I just booked 21 new workshops last weekend, so this year I'm doing 49, which is the most I've ever done. I'm basically home for Christmas, Thanksgiving, and I think my anniversary, we're actually in Australia, so I'm home for the primary things. But you can go to www.orthomassage, that's O-R-T-H-O massage.net. Make sure it's net, not com. So www.orthomassage.net. You can also call 1-800-643-5543, and you will see the book on there. Our website is brand new website is being launched this coming week. We've spent all Christmas break rebuilding this website. You will see testimonies from chiropractors, physical therapists, athletic trainers, live testimonials throughout the world of manual therapists that their practice has drastically increased because of the work. And then we're shooting 2 new DVDs in February 5th, which Multiple Crush Phenomena is my favorite and my most passionate work, so that's going to be shot. And then lower extremity and ascending syndrome, stuff that happens in the lower extremity that manifests as knee pain or back pain or neck pain. So all of that will be available on our website, orthomassage.net, www.orthomassage.net, or they can call 1-800-643-5543. And our worldwide schedule, our products, our books, our videos will all be available.
Fantastic. It's a great resource. I can't wait to see the new website.
Great.
And now I want to make sure everyone knows how they can be a part of your classes and the conference as a whole. The American Massage, Chiropractic, and Acupuncture Conference is one of the largest exhibitions of massage, chiropractic, and acupuncture products, continuing education, and business opportunities for practitioners of all disciplines. This year's event will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including James's 2 different 1-day classes. Other events during the weekend include a free keynote presentation sponsored by ABMP with Dean Juhan, the author of Job's Body, a charity golf tournament benefiting the Make-A-Wish Foundation, and the One Concept Gala and Dinner Dance. And the registration cost for the conference is just $40, which includes admission to the trade halls and all 1-hour presentations, participation in raffles and giveaways of literally thousands of dollars in prizes, and between class coffee breaks, as well as loaded goodie bags. Attendees will have access to many special offers and promotions from the conference exhibitors, as well as the chance to have a fantastic time with friends and colleagues. Now for students, the conference offers a free student day and Smart from the Start program on Friday, which is sponsored by Massage Warehouse Script and Performance Health. This day is dedicated to massage, chiropractic, and acupuncture students who are currently enrolled in school or who will graduate in 2012, and includes a free gift bag for the first 350 people. Also on Friday, all attendees are invited to attend a special presentation, Disciplines Unite, from 12 to 2, and the One Concept Job Fair from 2 until 4. All of this is happening at the Conference Hotel. That's the Town and Country Resort and Conference Center, and I definitely suggest you make plans to stay there if at all possible. Single or double rates are just $125 a night, but space is limited, so make your reservations now. Also, MPA Media is printing the American Massage, Chiropractic, and Acupuncture Conference event program inside all 3 of their magazines, Massage Today, Acupuncture Today, and Dynamic Chiropractic. These will be given out at the conference and distributed throughout the U.S. to over 133,000 practitioners. So if you are a vendor or educator who is listening in today and you want to get some great exposure for your classes or products, please contact Sandy Pierce of MPA Media for more details on how to be a part of the conference program. If you are ready for the American Massage, Chiropractic and Acupuncture Conference, April 20th through 22nd in San Diego, California, and to meet James Weslowski, myself, and the other amazing presenters, we would like to see you there, and we want you to register as soon as possible. So you can do this 2 ways. First, you can register online and pick your courses instantly at the official conference websites at AmericanMassageConference.com, AmericanAcupunctureConference.com, or AmericanChiropracticConference.com, depending on your discipline. You can also register by phone. Your call is free, and our operators are waiting at 877-674-3504. I'll say that again so you can write it down. That's 877-674-3504. We also invite you to stay connected with us on Facebook at facebook.com/American Massage Conference, American Chiropractic Conference, and American Acupuncture Conference. That's 3 different pages, by the way. Again, the 2012 American Massage, Chiropractic, and Acupuncture Conference is made possible by all of our wonderful sponsors. Thank you so much to Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, and Massage Envy Careers. I hope after today's broadcast, everyone listening is ready to come to the conference and register for these 2 8-hour classes: orthopedic massage for complicated shoulder conditions and pelvic stabilization, and orthopedic massage for complicated cervical conditions, and elite sports therapy with James Weslowski. James, thanks again for taking the time to talk with us today and for choosing to be a part of the 2012 American Massage, Chiropractic, and Acupuncture Conference. We're really excited to have you at this year's event.
Thanks, Felicia. And I just want to remind you to bring your dancing shoes, Felicia, because I've been taking ballroom dance for the last 2 years now. So
he's going to show me up, you guys. He's going to show me up once again.
The gala is also awesome. That's basically what I'm trying to say. I really look forward to it.
Yeah, well, I'll definitely save a dance for you. That's for sure.
Great.
I can't wait. This is Felicia Brown, and on behalf of everyone from the American Massage, Chiropractic, and Acupuncture Conference and One Concept Radio, I want to thank you for tuning into this edition of the pre-conference broadcast series. Please remember to tune in each week through April 16th for more interviews and to visit our websites and Facebook pages for replays of all the interviews in this series. We look forward to seeing you in San Diego in April. Please also consider joining us for the Canadian Massage Conference, November 1st through 3rd in Burlington, Ontario, Canada. Thanks again for tuning in, and have a fabulous day.